Let me see how many of you have uh, got to know about the fungating wound.
Please unmute yourself. Yeah, sorry. So please unmute yourself and talk. How many of you have seen fungating wound? Yeah, anybody?
You can put in the chat box also, no problem. Have you come across any such wound? Okay, someone has. Okay, good. Anyone else? Okay, no problem. Later on also we can discuss. So, what do you mean by fungating wound? So, it is a cancerous wound, mainly maybe because of the primary tumor in the skin, or it is the somewhere else the disease is cancer is of other organ, but the metastasis has taken place at the distant part. Okay, so both way you can see. So generally it is seen as the complication of cancer. Okay, and mainly so we will see in advanced disease. So why it is caused? Because mainly the reasons are the direct infiltration of the skin, tissue, mucosa, and local blood vessels, lymph vessels by the tumor itself. Okay. Then other thing is, as I told, that it can be metastatic deposit also. Okay. And of course, very well in the case of primary skin tumor. So why it is so important to take care of this type of wound? So basically last time also we had discussed that any wound, any injury to the body part, it is essential that we see to it that it gets healed. Okay, and also look at uh, the problems of it and prevent all the types of complications. Okay, so that's what we had dealt last time also. So generally it is said that around 5 to 15% of the cancers result into fungating wound, right? And how bad it will look on the body part. The body part can be open, which can be seen, or it can be hidden under the clothes. Okay, but because of the type of wound and the problems it carries, it becomes very much apparent also to the opposite person. And it becomes very traumatic, isn't it? You can imagine the condition of a person who is having this type of wound over the any part of the body. Okay? Because it will be a constant reminder and a visual reminder, you can say, that the person is moving to more and more complications, and most of the times it can remind him that his end is near. He is going to die soon. Okay? Whenever he sees his wound. So it is not only physical trauma because of the wound, but also it deals greatly with one's psyche also. They also will be painful along with the wound. The wound itself will be painful. Plus, it will cause high levels of exudate, so much of oozing coming out of the wound. Very difficult to manage these exudates. Okay? Many times if the wound invades, the tumor invades the blood vessels, it can be major bleeding also, okay, when large vessels are involved, and it will give severe stench, okay, malodorous. So we will be discussing all the problems in detail and how we can solve the problems. Okay? And here the basic thing will be that we will very difficult to heal this type of wounds. So how to give maximum comfort to the patient, that will be our sole purpose. Okay, so what are the characteristics of this wound? Okay, and where you will find maximum, where on which body part it will be found. So it looks like fungal infection. It will look like a fungus, large amount of fungus. It will have appearance of cauliflower, and it will look like crater. Okay, so on the sides you will see the border, and in the middle there will be crater formation from which there will be large amount of secretions coming out, exudates coming out, and it will grow very rapidly. If within no time, you will see a large cauliflower appearance. It can ulcerate also, and it can proliferate and fistulate to the nearby cavity, body cavity, or the part of the body. And various symptoms will be found. So we will see them. And most common site of this type of wound is the breast cancer wound. It can be also seen in the case of head and neck cancer. As you can see here, it can very well take place in soft tissue sarcoma, kidney, bladder, lung, ovary, vagina, colon, and penis are again a common site where it can uh, proliferate into large wound. And each presentation would be different in different persons. So this is the process of development, how it goes further. Okay, so fungating lesion is there, rapid proliferation of cells you will see, or cells will be immature, and it will give cauliflower appearance. There will be ulceration taking place, and it will cause to look like open crater, and there will be erosion of sinuses also, so that there will be large amount of oozing from the wound. Why symptoms occur? Okay, basically because of the vascular deficiency, what happens, it affects the blood flow. Okay, and there will be poor cell perfusion. The local level cells will not be perfused with the blood circulation. Okay, and because of that, there will be hypoxic regions, and because of that, there will be necrosis. On the other hand, because of the absence of or abnormal lymphatic vessels, because of the tumor cells, this has taken place. Okay, it will cause increased interstitial fluid. There will be escape of the fluid. Okay, and that will increase extravascular pressure. So what will happen is that the blood vessels will collapse. Okay, and because of that, the exudate will take place. Now the fluid will be coming out of the tissues directly. They will not go, the fluid will not go back into the vessels. Okay, you say that the lymphatic vessels and the veins, right? So instead of that, you will see the tissues directly oozing the fluid. Excessive cell proliferation, what it will further do, it will cause the medium become acidic. Okay, pH will become acidic, and there will be interference because of this in the clotting mechanism. Okay, and because the clotting mechanism fails, what happens is that bleeding take place, and the tissues will be very fragile. Okay, they will come off very easily if whenever you try to do dressing. Okay, so chips of these tissues will come off when you try to do dressing. And because the area is moist now, what will happen? More and more infection will take place. The bacteria which will be involved in this can be anaerobic also and aerobic also. And they will further secrete the fatty acids. Okay? And there will be tissue destruction and it will cause lot of malodor. Okay? And further exudates will be seen. Okay, so all these problems you will find in the fungating wound. So as we discussed previously, that healing will not be our objective. Okay, what we want to do is provide maximum of the comfort to the patient by how? By symptom control. Okay, so that will be our primary goal. And as we know that we always have to do assessment from all the 4 sections of the health, right? So you will also assess along with the physical factors, you will see to it that social factors are also assessed, psychological factors and spiritual factors. So all these points have to be kept into mind whenever we are treating the patient with fungating wound. It is very complex also to manage. Okay, so proper plan should be done for how you are going to do the dressing and what other care you can give. You can also discuss along with the healthcare team members whenever you have to deal with such patients. So that will give you better idea how to go about it. Why assessment on the regular basis is needed? Because we want to monitor the effects of the treatment, whatever we are doing, how efficient we are in giving care. So that is the first important factor to remember. Also, there can be side effects from the treatment. The person might be taking chemotherapy or radiation therapy as the palliative radiation or palliative chemo, right, to reduce the wound size, okay, and keep the symptoms under control. But this treatment will also giving rise to side effects. Okay, so always discuss with the patient and family before going into it. Okay, so that the patient and family should not feel that we were kept in dark and we were not told about the side effects of this other therapy. Generally, what happens in people's mind is that whenever we want them to undergo any chemotherapy or radiation therapy, they feel that still the disease can be controlled or it can be treated. That is why we are advised these things. Yeah, but it should be made clear that we want symptom control. That is why it is given. It is not for the cure of the disease itself. Okay, so our objective should be clear and that should be understood by the patient and the family members also to prevent further psychological problems or any physical also. Also, it is to provide insight into patient's quality of life, how patient is feeling with the help of our care. So that is why this assessment, regular assessment is very much needed. And not to forget the documentation of the assessment. So let us make a quick list of problems, how the patient will be feeling. You can make list of problems under 4 domains. Okay, all 4 domains, you make headings and quickly jot down the problems. One old lady is having wound over her cheek. Okay, so how she would be feeling. Another person is having the wound over the extremity. Okay, so both will have different issues physically looking at, right? So what can you find as per your approach, and you can put down the problems in the chat box. Let's take 2 minutes for this, and then we will move forward. Please give your answers in the chat box. What problems, what physical problems will you find in the person? What will be the psychological problems? What will be the social problems? What will be the spiritual problems? Okay, pain, yes. Physical problems, yes, good. Appearance, yes. Disfigurement, good. Yes. Anything else? Yes, emotional, yes, good. Right. So, so many things they will come up, right, when you assess the patient. Now, what happens? This many of these patients will not have proper access to the medical care. Okay? They will be very much afraid to approach to the hospital, and very less number of persons will have actual home care medical facilities, right? So it means that the patient and caretakers will be much at the, I mean, they will not be having any point of or expert guidance. So there are more chances that the complications will arise, impacted wound it will become. Okay, and because of that they will have anxiety also, right? They will lose their confidence, right? Plus the greatest thing is social isolation they will suffer from, right? So along with the physical pain and exudates, these things also will be very much possible. Now you can see that physical problems, as you said, okay, we have to look after the location and the size of the wound. What is the size? It can be small also, but within no time it will become very big also. Right? What are the tissues, type of tissues that are involved in the wound? Okay, that will also have a major concern. How much is the amount of exudate? Okay, how much oozing is taking place? Whether order is there or not? What kind of order is there? Okay, pain level. How much is the pain? Right, so severity pain assessment will be very much essential to do in this, and because of the oozing and all, the person will have lot of itching, pruritus will be present, right? Not in the wound, but also because the as we just saw that pH is acidic side, right? So what happens is that the surrounding tissues will also become very much vulnerable to the destruction. Okay, and because of the oozing and all, it will be all the time wet. Okay, so the surrounding skin will also give much problems. Then effects of on the daily activities because of the presence of the wound, right? And how many times in a day the person has to undergo dressing procedure, and with the dressing will come the vivid memories of the pain also, right? So and this, as the wound is quite big, you can imagine the size of the dressing also, right? It will be very much bulky, So you can imagine if the person is having wound on the neck, say for example, or over the breast or even on the mouth, that you can imagine the patient's problems and the difficulties of the relatives also, caretakers also. Right? And if the patient infection has taken place into the wound, then even more difficulties. Next is psychological issues. Okay, these are just to name a few. Okay? So someone has rightly said that body image will change, right? Malodor will cause, they will not, I mean, their appetite will be reduced, right? Communication difficulties will be there. And every day there will be change in the appearance, okay? And they will feel very depressed because of that. Cosmetic effect of dressing also we have to see, because it becomes very bulky. Social isolation also and rejection also. Always people will think that they have the patient and the relatives, the family itself has some curse, so that is why the problem has come. So they will be isolated, so it will come under the social issues also, and the effects of isolation on the psychology of the person. Okay, the person can have denial also, right? So still the person will have that, okay, no, this wound I can overcome, it can get healed, and it is I mean, still he is not believing that this can happen to me. Okay? Agony of rejection and defeat, they will feel that so much treatment I had undergone, then also I could not beat the disease. Okay? So that agony can be there. Patient can go into depression. A lot of embarrassment will be there. Okay? And it is these things are sometimes patient don't come up, don't discuss openly, right? But whenever we find any such patient, we have to understand that these constantly this cycle of thoughts will be going on in his mind. And of course, who is not fearing about the death, right? One's own death is the greatest fear. Also there can be guilt also. What about the social issues? Okay, you can imagine if the couple is there and one of the person is having the wound, such wound. Okay, so what will be the impact of on the spouse? The family may have small children also. Right? What are their concerns? They will be very much afraid naturally looking at the wound, right? So they will not go near to the person, and it can cause a lot of psychological, emotional problems. There will be constant order in the surrounding environment. Okay, and many times this will make it very difficult meal times. Okay, they may not be able to take meals together. The person will be kept in one corner of the house, and most of the times these people live in very small house too, right? Hardly having one room or two rooms, and the person will be many times put outside the house. The patient is not allowed inside the house. So somewhere under the tree, the person's bed will be there, and he will be just lying on the sheet, not even having a mattress also to sleep on. Right? So many difficulties they will be having. There will be a lot of restrictions because of the dressing changes also. Because with the dress, there will be so much of oozing that it will become very difficult to have that much of dressing material. And many of the patients will be lying openly only, right? And all the time the dressing would be soggy with the fluid. They will have, they will lose their self-respect and self-esteem, right? Patient will have revulsion and disgust feeling. Sexuality will be lost, Right? Hardly in Indian scenarios they openly discuss about this. Patient may be having shameful feelings, social isolation, we just talked. Right? So lot of social support is needed. Okay, and not to forget about the economical situation, because day by day the size will increase and the material which they will require for dressing will be increasing. Okay, so economical situation should not be forgotten also. And what about the spiritual issues? Spiritual issues is not only about the uh, prayers or praying to God, right? It can be a lot more things also. So we need to further dig into this issues also in the as a patient, and also for the caretakers or the family, you can see. Uh, they will have feeling that why it has occurred in me only. They may be knowing a person who had not any fungating wound. Okay, so why it occurred only in me? I had done anything wrong. I had not prayed enough, not paid proper attention, not donated any money on the religious sites, not visited. Lot of questions they will have. Many times they'll end up into anger also. Okay, uh, so more and more suffering, and because of the rejection from the community, they will have more problems, right? Even community will also think that it is God's curse on the patient or family. So they will not be allowed to take part in the religious activities, or may not be allowed to come in to the religious sites. Okay, so these things will further result into a major despair. When we are taking care of such wounds, we will see to it that we remember all these points. Okay, mainly, it will circle around these things that take care of the pain. Right. So for that, we need to do pain assessment. You must have learned that. Okay, what next will be? It can be exudate also. There can be bleeding also, and malodor also, and in some cases even maggots also. Okay, and if there is other bacterial infection is superimposed on our fungating wound. Okay, so we will have to remember from this point of view. Okay, so first is many times the radiation therapy and chemotherapy is given to the patient. It is to control the wound. Okay, symptoms will be controlled, oozing will become less, and in some cases the wound may become even smaller size. Okay, so that can occur. But as talked earlier, we have to tell them about the side effects also. Right? Sometimes there may be the procedure of debridement. Okay, so in such cases, we have to assist to the surgeon. Then control of infection with the help of the systemic antibiotics. Okay, so as per many times, culture and sensitivity test is also done to identify which type of infection is in the wound and which antibiotics will be effective. So that can be done. Then for type of pain, we need to do pain assessment, and what kind of pain it is. Depending on that, as per the WHO ladder, we have to give the analgesic drugs. Okay, and we need to remember that adjust the dose, and no two patients are same. Right, so each one will have their own prescription of the analgesic drugs. And when we are doing the dressing, we have to remember that we have the patient has to be administered a dose of analgesic drugs before 30 minutes of the dressing. or you can do it, what you can do is that adjust the time of the dressing after 30 minutes of the dose of the analgesic drug. Okay, so either way you can do. You can also give extra dose of morphine 30 minutes before dressing. So it will help in controlling pain. If the person is having superficial pain like burning pain, if he is complaining, or stinging type of, like the honeybee is stinging, that type of pain is there, then we can also use lignocaine jelly or local opioid also, and soak the part 10 minutes before dressing, and then do the dressing. Okay, so that will reduce the pain. For any incidental pain, can be given ketamine, even sublingually also. What about malodor? So malodor, as we saw in the pathophysiology, that it is because of the anaerobic bacterial growth in the dead tissues. Okay, so what to do? So the person should be asked to take good bath before dressing. Okay, so with that, what will happen? That the all the necrotic tissues and all will be washed away, and the dressing will also become loose, so it can be easily removed. Okay, otherwise you can soak the dressing in the normal saline. Then after it is cleaned nicely with the normal saline, you can apply metronidazole tablet powder. Okay. You have to instruct the patients and the caretakers to crush the tablets and store it in the airtight container. Many times metronidazole irrigation is also done. That also decreases the amount of odor, and nebulization also helps. Instead of normal saline in the nebulizer, if you put 2 ml of metronidazole and then nebulize, the vapor is allowed to penetrate into the, especially when there is a deeper wound, and I mean, when the wound is extending into the cavities, fistula has taken place. So at that time, this becomes very effective. Systemic metronidazole is also given, and if the patient is developing any kind of side effects and all, then drugs should be given for that. So this is how it will help in controlling of the malodor. When the patient is having any oral wound and the very bad odor is coming, so at that time you can tell the patient to gargle with the help of the metronidazole. What you can do is take warm water in a glass, and add 3 to 4 metronidazole drops. Okay, injection metronidazole, 3 to 4 drops, and then the patient can gargle with the solution. And it is very bitter in taste, so you have to tell the patient in advance. If the wound is painful, then we can mix metronidazole powder with the lignocaine jelly and then apply it on the wound. Okay, and how to go about it? That you don't have to put it directly on the wound, but you take in the your dressing material and then apply on the wound. Okay, so that not to cause any more injury, further injury or bleeding on the wound. Dressing is done at least twice in a day. Okay? And in case of presence of infection, we have to give systemic or topical antimicrobial drugs. Many times charcoal dressings are also available, so that can also be used for the odor control. Of course, these dressings are quite costly also. So for the patients who can afford, it can be done. Other things what is done is the simple charcoal which we use for our cooking. Okay, so those pieces can be kept under the patient's bed in a bowl. Okay, so that will absorb all the odor molecules from the atmosphere. Even keeping pieces of the newspapers under patient's bed sheet will also help. Here what will happen is that the carbon in the newspaper ink that is used will absorb the this vapor molecules. Okay, so other things like incense sticks or kapoor or air freshener can also be used for control of odor in the environment. It is very, very important because you can very easily find out if the person is there with such type of wound right from the entrance of the patient's house. Okay, that much stench it will be giving. So you can imagine the condition of the persons who are 24/7 living in that type of environment. Okay, so lot of things are involved along with the wound itself. Okay, so we should not forget this. Next is about care of the exudate. So how to go about it? So regular dressing is always there. Okay, and it will also again cause significant problems in the quality of life of the person. Okay, and day by day, the amount of secretion will also increase. So, along with the soiling of the dressing, the surrounding skin, that is peri-wound maceration, will also take place, and that will area will also become very soft and tender, and it will easily break. That surrounding skin will also easily break. Okay, so we have to see to it that we absorb maximum of the exudate. Okay, so for that, what kind of material should be used? So generally what we use is the gauze dressing, right? Gauze dressing along with the cotton that will be applied over the wound. Okay. Other materials which are used, which will absorb a large amount of exudate is foams. Alginates are also available and hydrofibers. Like diaper technology material, so you can cut them diapers into the small pieces as per the shape of the wound, and you can put there. And also many places sanitary pads are also used, okay, because they will again absorb the liquid and make it into gel. Okay, so large amount of secretions can be absorbed. So these type of materials are also quite familiar among the people who are working for palliative care patients. And of course, when there is infection, treat it with the antibiotics. Many places, honey, silver, and iodine containing materials are also used. Dressing solutions are also used. So what is required is that frequent change of dressing. Okay, not to forget that. And of course, it will depend on the how much is the oozing. Here you can see that the surrounding skin also need to be taken care of. Okay, so barrier film products are useful as they will become the skin will become very fragile. Okay, so minimize the skin contact with the exudate and protect with the suitable barrier cream or film. Palliative radiotherapy may be beneficial as we just discussed earlier. Okay, so these are the materials, list of materials, and what are the benefits are there by using these materials is listed here. foams, they will promote the moist wound environment and does not adhere to the tissue. Okay, it also will you can, I mean, got into shapes and sizes. So it is very easy to use also. Calcium alginates are also available that can be used to cover or fill the wound bed. Okay, and again, it will become gel and absorb the drainage. Okay, and it also acts as hemostatic agent. Okay, so if the bleeding is taking place, then also it will be helpful. Honey has high osmolarity. Okay, so and also it has bactericidal effects. Okay, so it helps in healing. Silver, it is released gradually in the tissues. Okay, and it acts as bactericidal. It has effects. Charcoal, it will absorb the gas molecules and bacterial spores. So in the dressing, it helps. Dekin solution is also helpful for its bactericidal effects, and it also removes the necrotic tissues. Okay, so it helps in that way. Metronidazole, of course, it has bactericidal effect and also for the bad odor. So what to do if the bleeding takes place? Slightest injury, okay, when you are trying to clean the wound, so bleeding can occur. It can be in small amount also, it can be in large amount also. Okay, so for that, you have to apply pressure locally for 10 minutes. And if it still continues, then for longer period of time. Here we also have to find out if there is any infection, then treatment of infection is also essential. Topical sucralfate powder, the tablets again, that can be crushed and applied. So it will form coating and it will stop the bleeding. In large amount of bleeding cases, systemic ethamsulate may be given or tranexamic acid can be administered systemically. Okay. Adrenaline packs are also useful, but needs to be used with caution because it tends to elevate the pressure, the blood pressure. So further bleeding with more force can occur. Naturally, when there is large amount of the dressing materials is involved, we have to teach the carer how to do sterilization at home. Right. So for what we have to do, last time we had seen how to prepare normal saline solution. Okay, so that is repeated again here. And preparation of sterile dressing material, what they need to do is they can take any clean cloth that is nicely washed and then sun dried and cut into the size of the wound. Okay, and then it can be sterilized, steam sterilized, either in the cooker. If you are using cooker, then not to put the whistle over it, and otherwise it can be sterilized in the deep vessel where you have to put a mesh-like vessel first in the water so that the water will not enter into the our cloth pieces. Okay, and then for half an hour you can keep and the material will get sterilized. And the relatives also have to remember to wash their hands before and after dressing. And as we just discussed that bleeding can be there, so anyone will get frightened by looking at the blood, right? So they can use dark colored clothes. We keep you have to everything in advance. You have to tell the patient that in such case, if this happens, then cover the blood side with the dark colored clothes. Either use green or blue color. Okay, so if the side doesn't become very, they will not be afraid. And how to dispose the waste material. Okay, that also need to be taught to the patient's relatives. and regular follow-up with the care team. If by chance we always pray that there should not be any maggots, or the wound should not become infested with maggots, but sometimes it can occur. So what to do at that time? Okay, so first, prevention is better than cure. Right? So always instruct the patients with this type of wound to sleep or stay in the mosquito net as far as possible, of most of the hours of the 24 hours of the day. So you have to clearly instruct, and why it takes place, that also need to be taught to the patient and the caretaker, that it occurs when the house fly will sit. It will naturally get attracted because of the smell also, and the soggy nature of the wound, and the secretions. Okay, so flies tend to get attracted to the patient, and it will sit over the wound and lay the eggs. Okay, and these eggs will hatch, and the maggots will come up. Okay, so we have to educate the patient why these maggots are there. Okay, then they will understand the importance of remaining in the mosquito net. Okay, so maximum cleaning and dressing should be done. Okay, and for maggots, what to do? That take a gauze piece and soak it in the turpentine. And you should never drop the turpentine in the wound. It is very irritating. Okay, just keep the gauze piece, hold it near the wound, so that what it will do, it will cut off the oxygen supply to the maggots, and the maggots will try to come out for the oxygen. Okay, so at that time you have to take it with the help of the thumb forceps, and never to follow inside the wound, because otherwise your thumb forceps will injure the fragile tissues. Okay, and it will cause more injury. Bleeding can also take place. And repeated dressing with this turpentine, in few days the maggots will be removed completely from the wound. Every time you remove the maggots, you have to count them. Okay, so slowly, and record them. So slowly your count should become less and less day by day. And when you are covering the wound at that time, you have to remember that there should not be any gaps left. Okay? Put the dressing material, cover the whole wound, and apply the micropore in such a way that there is no gap between the tape and the skin. Okay? And over that also, the person has to wear any, say, if it is in the neck region, then they have to cover with the cloth. So this care should be taken so that flies don't directly sit on the wound. So this is the wound with maggots. Other local applications that are used for removing maggots are mineral oil, ether, chloroform, ethyl chloride, mercury chloride, creosote, and of course cleaning with saline and all also helps. Okay, so there are many other materials, solutions which are used, and they can be applied over the wound. Surgical debridement can be used for the removal of maggots if there is large amount. Okay, so this can be used. There are many research papers also, use of systemic ivermectin, albendazole, and clindamycin. It is also known as triple therapy. So that is also useful for maggots. So taking care of psychological issues, you have to counsel a patient how well he is able to use the coping mechanisms, regular visits by the team. Okay, always keep the part covered to feel less embarrassed. Okay, wear dark colored clothes, or whenever they have to move out or the chances of bleeding is there, and drugs can also be used to reduce anxiety and depression. Social needs, counseling of not only the patient but family members, and acceptance of the patient as he is very, very important. Right? If needed, take help of the social workers also to identify further needs of the patient and take support of the NGO. What government support they can have, like getting BPL card or ration card or like that. For that, each region will have different government support system. Right? So one should have the general idea uh, what documents are to be kept ready. So you can help in that also, and which forms to be filled, where to go, right? All those support they generally require. So as nurses also, we should know them. Spiritual needs, again, counseling if needed, the visit from the religious leader, okay, attending to the wishes of the patient. Then in communication also, you might have learned about the taboos and all, how to remove, breaking the barrier, right? Bad news, how to do and all. So you have to use all your communication skills also while taking care of such patients. So with this, I will end my today's uh, presentation. Thank you very much. We can discuss if any problems.
Thank you, Anna, for the wonderful presentation. Anybody have any doubts regarding this? Please ask her. Anybody? Anna, one question is there. For removing maggots, can we use hydrogen peroxide?
Hydrogen peroxide, last time also we had discussed that we don't use it. It does more harm than good. So hydrogen peroxide should not be used.
It will not help. If you use hydrogen peroxide for removing maggots, it will not help. So if you use turpentine, so that will reduce the oxygen supply, and then the maggots will try to get out of the wound to take oxygen. So that time we will take it out. So that is how we remove the maggots from the wound. So any other questions?
With camphor, we generally don't use here, so I have no idea about the.
Even even I don't have any experience about that. So who said camphor? Sunida. Do you have any experience, Sunida?
Yes, ma'am. Here in Nepal,
Ah.
we use camphor to remove maggots.
Oh, okay. Thank you. Thank you for sharing this. We don't have any experience on that.
Okay, ma'am.
How will you use?
We have to make in powder form, then sprinkle on wound.
Okay.
Yes, ma'am.
Camphor is again of two types, isn't it? The camphor is what we call it kapoor, no? That only.
Yes, ma'am. It's Kapoor.
So that what is generally used for the puja, that kapoor you use?
For puja, I don't know, ma'am, but in Sunday we use
So
for
in,
patient maggots.
Any other questions? So I think no more questions. Before moving on to the patient story, I would like to highlight few things about today's presentation, because as Anna ma'am said, this is a non-healing ulcer. Last week we learned about the pressure sore. The major difference between pressure sore and fungating wound is the pressure sore is preventable and curable. This is not preventable and not curable. So this is the major difference between pressure sore and fungating wound. So this is a non-healing ulcer. This will be affecting the patient as well as the family members. It will this so non-healing ulcer can cause lot of physical problems, lot of psychosocial problems, and spiritual problems. So this patient needs holistic care, and also the patient needs an empathetic care. So always treat the patient in an empathetic way, and try to assess well, because if possible, you have to do the individual assessment. In front of the caregivers, they won't tell the truth. So that is my experience. In front of the caregivers, if you ask something, so they definitely said she will or he will take care of my wound. But if you do the individual assessment, they said nobody is willing to take care of my wound. So they are afraid. So that kind of things will be there. So if there is sometimes maybe the misconception of the disease, sometimes they are afraid about the maybe spreading of disease. So that kind of things will be there. So if that kind of that problems there, you can do the individual counseling and make sure that there that you have to make them understand there is no way to spread this wound if you take care of the one thing they can do is wash hands with soap and water before and after dressings. So it may be not spreading to one or spreading from one to another. That the important message we need to convey with the caregivers. Okay, so then we can try to involve the caregivers into the patient's care. And the other thing is, if the patient is able to take bath, you have to encourage the patient to take a good bath. So because this wound is fragile and a lot of necrotic tissues. So if you apply more pressure on that area, it will cause bleeding and pain also. So if they are able to take a good bath, so all necrotic tissues will fall off. So if possible, you can encourage for same. And then after that, you can clean with normal saline and then apply metronidazole powder. So metronidazole is the good agent for controlling anaerobic bacterial infections. This is the drug of choice of anaerobic bacterial infection is metronidazole. So you can apply systematically that topically and systemically also. So that malodor is not controlled, you can give orally also three times a day, and one BD, something like that. But the thing is, one common side effect is nausea and vomiting. So if possible, you can apply topically. So that will help to control the anaerobic bacterial infection and malodor. So and coming to the last thing, bleeding. So this is very, very common. Before doing the dressing, before removing the old dressings, you have to soak the all the dressings with normal saline or plain water. So dressings are adherents to the wound. So when before soaking the wound, when you try to remove the old dressings, it can cause pain and bleeding. So before removing the old dressings, you can soak well and remove it. And also you have to train that, educate the caregivers about how to manage if there is a huge bleeding there. So they have to wipe out the blood with a dark color cloth. This is very, very important. If there is a head and neck cancers there is a chance of developing profuse bleeding accident. Maybe the patient's death because of that bleeding. So we have to prepare the patient family about how to manage bleeding. So they should wipe out the blood with the dark color clothes. So that way we can able to reduce their anxiety level. And the last thing, maggots. As ma'am said, if there is a maggots formation there, you can soak the gauze piece with turpentine oil and keep close to the wound. That time the maggots will come out. So you can take it out with the help of artery forceps or a thumb forceps. And education is also important. So always cover the wound. They don't know the maggots are come from house flies. So that important message you have to convey with the caregivers and the patients. This is why we will tell you about the importance of covering the wound. You should cover the wound always. So otherwise there is a chance of maggots development. So that important message also you can convey with the caregivers and the patients. And if you are taking that maggots, don't follow maggots. If you follow maggots, that usually the maggots will come out when you go with your artery forceps or a thumb forceps. They go inside. So there are a lot of pocket formation inside. There are a lot of areas inside. So when you go with if you follow maggots, what happened? Your artery forceps or a thumb forceps will rupture the blood vessels, damage the blood vessels. So that is very common. So when they come out, you can take it out. Otherwise, leave it. So after a few minutes, they will automatically come out with. So that time you can able to take it out. Don't follow maggots. So I think we can move on to the case presentation. Anna, can we? Yes.
Yes.
Okay. So Miss Pauline will be presenting a patient story today. Pauline, so over to you.
Yes. Hello. Am I audible?
Yes, you are.
Okay. Good evening to everyone. Good evening to everyone. Actually, I am on travel. Sorry for the inconvenience. From Emmanuel Hospital Association, unit of Premjudi Community Hospital. Let's move to our patient history. Patient age is 75 years, male patient. Diagnosis Parkinson disease with a diabetic mellitus, hypertension, stage 3, pressure sore on right thighs and right gluteal region. Presenting complaints: dysphagia 4 days, constipation 2 days, slurred speech, sleep disturbance, stiffness of body, dementia, unable to walk, bed sore over right thigh and right gluteal region, warmth and tenderness, exodus present, moderate pain over hip region and wound site, urinary leakage also there. History of illness: he had a history of falling down on floor by slippery when he walks, followed by severe hip pain and unable to move, and was diagnosed with the hip fracture in September 2020. Admitted and had hip surgery from one of the private hospital and discharged after 3 weeks. Also, he has been taking treatment for diabetic and hypertension since 20 years. After surgery, he could not walk by himself and he has slurred speech, difficulty in swallowing. And again, he admitted and diagnosed as advanced Parkinson's disease. After 6 months, he developed sore over right thigh and gluteal regions, stage 3. History of pain over hip region and wound site for more than 2 weeks. Wound pain over hip region, and then his wound site, like wound pain, 6 by 10 intermittent and burning type of pain. Wound site 5 by 10 continuous thrombing type of pain, so that sometimes they keep wound open. And also he has history of disturbed sleep, decreased oral intake, loss of memory, confusion. Examination. On examination, patient was subconscious and disoriented, temperature 98.2 degree Fahrenheit, pulse 88 per minute, respiratory rate 24 per minute, BP 140 by 90 mmHg, systems normal, and then saturation is 98%. Treatment and significant investigation has done for him. So investigations as follows: ESR half an hour 8 mm and 1 hour 20 mm per hour, sodium 121.4 milliequivalent, and then potassium 4.24 milliequivalent, serum triglyceride 98.0 mg, and serum cholesterol 130 mg by DL, SGPT 25, SGOT 25, SGPT 30, blood sugar 98 mg/dl, creatinine 0.7 mg/dl, TSH 7.11, RBC 7.16, WBC 12.47, platelet count 213, then RDW ST 49, RDW 26.7, neutrophil 10.70, lymphocytes 0.92, monocytes 0.42, eosinophil 0.29, basophil 0.14. Physical and spiritual aspects, psychological and spiritual aspects. He is retired EB officer living with his wife, and she is about 60 years old. He has 3 sons and all are married. He is the breadwinner of his family and managing his finance by his government pension. His wife is taking care of him, but for supporting purpose, one of the daughter-in-law also staying along with them, and the other 2 sons family been working in mission field. His wife also diabetic patients. Though she is taking care of him, she gets tired and weak. When she gets very sick, when he gets very sick, during that time, his sons are taking care of them if it is hospitalization needed. He is born Christian, having faith in God, but sometimes they feel lonely and get depression. His wife worrying a lot about him and saying, I lost my hope on his recovery. As he is go through this chronic disease, the family members are worrying about his illness and bothering a lot, and also his future medical expenses. Medications, tab Syndopa 110 mg BD, levetiracetam 250 mg BD, Talvaptan 15 mg, rosuvastatin, calcium 20 mg OD, ecosprin 150 mg OD, Rosalact 0.5 mg, Parkitidine ER 129 mg, TB grip 1.25 mg, tab Newhands OD, syrup Tarovit Z, and tablet Tonaman. So maximum he's taking Parkinson disease drugs only. Main concern is pain over hip and sore side, dysphagia, dementia, unable to walk, depression, emotional disturbance, financial problem. Summary: 70 years old man with Parkinson disease of advanced stage and bedsore patient with the present of bedsore over right thigh and right gluteal regions and with pain over hip region. Comes under discussion point on this conditions. How can we help through palliative care? What are the problem faced by his by this patient, and what are the solutions can give family can give it to family members to overcome from their stress, and what all can be done for this patient? These are the discussion points which I kept for this patient.
Okay, thank you, Pauline, for the wonderful presentation. Anybody need any more clarification regarding this patient story? Please ask her. So otherwise, we can move on to the discussion points. Anybody? Pauline, I want to clarify one thing. Did he able to take these medications?
Pardon?
Did he able to take this medication orally or right?
No, actually, at first he has taken orally, but then later this medicine has given through NG tube feeding.
Okay, now he is an NG2 feeding, right?
Sorry, last 1 week back he died.
Oh, he died. Okay, sorry.
And
Okay.
also one more
Anyway,
thing I want
anyway, that patient was on nasogastric tube feeding. And what about the urination?
catheterized,
Catheterized.
catheterization, yeah.
Okay, so we can discuss. The patient is no more, but we can discuss this patient story. If you have seen this type of patients in your settings, we need to manage. So we can discuss today. We would like to hear from the participant side, and over to Anna. If you have any suggestions, yeah.
Yes, sister, from the participants, you can tell the physical issues first, then we can have psychological, what to do, how to do. It is pressure, so right, so how to go about it. Patient had a fracture of right hip itself, right?
Yes, yes.
And he has developed sore also on right hip. So I was wondering that what was the reason why so much of pressure on the right side itself. Generally, it should be prevented. Pressure on right side should be prevented when the right hip surgery is done. So whether the wound came because of the surgical site or positions not maintained.
Pauline, are you there?
He admitted there in one of the private hospital only. Yeah, improper maintaining of position might be cause of bed sore.
Okay, so Dressing. At what was the stage? It was third stage.
Yeah, third stage.
Third stage. Okay. So what to do for third stage? Last time we had discussed.
Yeah, they did
Prepare.
BD dressing. Yeah.
We did dressing. Frequent change of position. Then what else can be done? Other members, please take part.
So we all nurses, please unmute yourself and talk. So how will you manage if there is a third stage pressure ulcer there? Any answers? Makima sister, how will you manage if there is a third stage pressure ulcer there?
We will provide air mattress
Very good.
and then 2 hourly position changing.
Okay.
We have to release the pressure from the wound. That's why we
Okay.
are positioning and providing air mattress, and then daily dressing of wound according to the condition of the wound.
Okay.
If he needs some debridement, so we can consult with surgeon also. Otherwise, we can do bedside debridement after providing appropriate analgesic.
Okay. Very good. Thank you for sharing.
Thank you, ma'am.
Any other comments? So if there is a stage 3 pressure ulcer there, as Anna ma'am said last week, we can give air mattress or water mattress, but air mattress is if the electricity is available, so you can suggest air mattress. And you can prevent that relieve pressure on that same area. You can put the another, you can give other positions to that patients. And also you can before dressings you have to make sure that the patient is pain free. If the patient is having pain, you can give a dose of analgesics and wait for another 20 to 40 minutes, and then you can ask the patients whether they are getting adequate pain relief, then you can do the dressings. So, and another thing is, if there is a black necrotic tissue on that area, you can remove the necrotic tissue from the wound. And also, you can teach the patient how to do the dressings and all. And if the patient's health condition is okay, you can think about the skin grafting also. You can refer the patient to the surgeon whether the skin grafting procedure is possible or not. So that also the possibility for the third stage pressure ulcer. And metronidazole. This is a cheap medication, so you can apply on that wound. So that will help to reduce the infection. And also, if you can mix with white petroleum jelly, that white petroleum jelly will give a moisturizing effect to the wound that will help to healing process in a good way. So both white petroleum jelly and metronidazole will help to healing process. So anything you want to add, Anna?
That's fine.
And also that diet also. The protein intake is also very important.
And, he is having moderate pain, right? So what kind of analgesics will be given? WHO ladder. Anyone is remembering?
Yeah, I think
Can
this
recall?
patient, this patient is having two different types of pain. He has neuropathic pain and nociceptive pain because of the burning type of pain, the patient is not able to cover the wound properly. So how will you manage neuropathic pain? And how will you manage nociceptive pain? Any answers?
Someone has written tramadol.
Okay. Any other answers? Amitriptyline.
Yeah,
Okay.
for him, doctor has advised amitriptyline only.
Okay. Thank you. So, okay, morphine. So if the patient is having nociceptive pain, your systemic analgesics, WHO analgesic ladder, so your systemic analgesics like tramadol, NSAID, paracetamol, morphine will help. But if the patient is having neuropathic pain, like burning type of pain, your systemic analgesics may not help. But tramadol will help you, the some sort of maybe 50% of relief that patients will get with from tramadol. So it has a neuropathic pain control action also. Otherwise, you can give tricyclic antidepressants like amitriptyline or imipramine or duloxetine, that kind of things you can give to the patients. And the another thing is, before doing the dressings, if the patient is having neuropathic pain, burning type of pain to the wound, into the wound, so how will you do the dressings? Before dressings, you can apply that silocaine, 2% injection silocaine or pipivacaine. Okay, you can take 1 ml bupivacaine into the syringe or silocaine, and again you can dilute with another 1 ml of bupivacaine or normal saline, not bupivacaine. You can if you take bupivacaine 1 ml, you can add 1 ml of normal saline and spread to the wound. You can wet that into the wound. So within 2 to 10 minutes, that patient will get an anesthetic effect to the wound. So that time you can, after that you can able to do the dressings. So that that is how we manage that neuropathic pain wound dressings here. We apply a local anesthetic agent like silocaine injection or the sensocaine injection. Anna, you want to add anything? Okay.
Same thing is done here.
Okay. Yeah. So how will you help this patient family? So he has a lot of problems, physical problems. He was on nasogastric tube feeding, and also he was on Foley's catheter, the continuous urinary.
He had,
Yes.
sorry to disturb, he had urine leakage also.
Yes, yes.
You
Yes.
mentioned, yes.
Yeah. So what is the reason? What could be the reason for urinary leakage for this patient? Please put your answers into the chat box. This patient is having a continuous urinary drainage, uh, and also he has developed urinary leakage. So what could be the cause? Mahima said UTI. Salome said neurological problem due to Parkinson's, impacted bowel, dementia and Parkinson's. Okay. Any other answers? Okay, thank you. Thank you for the answers. If the patient is on continuous urinary urinary drainage, like Foley's catheterization, so we need to understand that this is one of the foreign body, and you have to encourage the patient to take plenty of oral fluids. See, if there is a urinary tract infection there, if there is an infection there, there is a chance of urinary leakage. And another thing is, as one of you mentioned earlier, impacted stool. If there is a constipation there, so the neck of the bladder will be compressed with the hard fecal matter. So, and that urine is not able to coming out freely. That time there is a chance of leakage through the urethra. So this is the another cause. And the third one is if there is any blockage. If there is any the urinary tube blockage, Foley's catheter blockage or kinking there is a chance of leakage. So these are the three common causes of developing leakage, urinary leakage with a continuous drainage, the urinary drainage patients like continuous Foley's catheter patients. So always if there is a urinary, if the patient is complaining of urinary leakage, you have to try to identify the cause. So whether there is any constipation, any signs and symptoms of infections, any blockage, that kind of things you have to ask. And if there is any cause like this, any constipation there, you can do the constipation management. You can do either you can do the PRE. If there is a hard stool there, you can remove manually removal and you give an enema and get bowel free. Then that will subside. And the another thing is if there is a urinary tract infection there, you can give some antibiotics for that and try to control that, and then that way we can able to that reduce urinary leakage. Any other points you want to add, Anna?
That's all. Sometimes there can be, too much of bladder contraction, muscle contraction.
Oh, yeah, yes, bladder spasm. If there is a continuous bladder
Yes.
spasm there, so again, the patients will develop urinary leakage. And the thing is, if you inflate, if you put a new catheter, you can inflate for inflating the catheter, you can use only 10 to 15 ml of water. More than, if you take more than 15 ml, definitely after inflation, that patients will develop urinary spasm because the bulb, the size of the bulb will be increasing, and that the bulb will touch the bladder wall, and the patients will develop bladder spasm. So if there is a bladder spasm there, you can deflate the balloon and wait for some time, and then you can inflate. So 10 to 15 ml is enough for inflate the urinary catheter. So here, what are the solutions can be given to patient family to overcome from their stress. So we can give proper counseling. You can, at least you can listen their problems. So you can listen individual assessment. Like I said earlier, you can do the individual assessment. You can hear, you can listen their worries and emotions. Then they can able to express their emotions, and you can give some psychological support for that. And also you can connect with some NGOs nearby. So they can also visit at least once in a week or twice a week. So that time they will get some sort of relief. So, and if there is a local volunteers there, you can try to involve with the family. So they can go there and talk to the patients and they listen the family members worry. So, and if there is a problem there, we can able to try to help them. So at least we can able to hear their problems. If there is one person's will develop by disease, that whole family will be affecting. That is, we need to understand that is very, very important. So if you can imagine in your own family, if one person will get illness, that whole family will be affecting. No, so this is an incurable illness. Continues one bed-bound patient, so that whole family will be affecting. He needs they needs to take care of the bed-bound patients. At the same time, they needs to take care of the family things also. So that will be affecting emotionally, socially, spiritually, and all. So this here also the patients lost the faith to the whole. That is also spiritually also this patient and family was affected. So if possible, you can do the individual assessment and listening their problems. That way we can able to reduce their stress level. And as much as possible, if we can go there and support the family at least once in a week, that will help. That way we can able to reduce their stress also. Okay. So time up, Anna. Anything you want to add, or any others? Any comments?
That's fine. And also the daughter-in-law was coming and helping, so that was good of her. Family is supportive. So we should appreciate whoever is helping in care of the patient.
Yes.
That's all. Thank you, sister.
Okay, thank you. So you can wind up the session. Thank you, Anna.
Thank you so much.
Okay. Okay, thank you for the wonderful presentation. Happy to see you again. Okay. Okay. Thank you all for your participation and your that suggestions. Thank you.